Hello everybody, this is a video explaining what is probably one of the most amazing advances in orthodontics in the last 30 years. It's essentially a simulation software which is run by Invisalign and it's called a clincheck. And this is taken or produced using either dental models or a digital scan, and it allows you to see a simulation of what your teeth will look like straight. And it also allows us as clinicians and orthodontists to peek into the future and trial various options. So this is a case that I wanted to share with you, and one of our patients has very kindly allowed us to use their photographs. So these are the start photographs, and you can see the teeth are incredibly crowded. There's a very, very deep bite. And what we have is our crossbite here on the side, the center lines are wrong, and there's quite a lot of excessive tooth wear as well. When we look at the individual arches, you'll see that the bite here is very, very narrow, and this arch sweeps in and around. The lower teeth are incredibly crowded as well, and this is despite already having 4 teeth taken out as a child. The lower canines are almost totally excluded from the arch. But the really useful thing is that once we scan the patient, we are allowed to actually see their bite in 3D, which is wonderful for us as clinicians and specialists to be able to see exactly how the teeth bite, to see the teeth in individual isolation, and you can see how the lower teeth here have over-erupted excessively and also tilted back an awful lot, which makes the cleaning incredibly hard. It's very, very difficult to have healthy gums in a dentition like this. In the upper arch, you can see exactly how these teeth are swung in and also swung out. You can pick out the wear patterns on the individual teeth, and you can see how the bite is from both sides as well. So not only does it give you a fantastic ability to diagnose a case and to also help make your treatment more efficient, but we can simulate the improvement of the teeth by watching them move gently into the right position. And these positions are predetermined by the specialist orthodontist. So you can see this is the final positioning of the teeth from the start. And you can see how they relax into the arc, and the arch is established into a much more pleasing form. The upper arch here starts off very, very narrow, and you can see as they start to align, we create space to idealize the position of the teeth so that from the front they look a lot more pleasing. We can also see the effect on the bite as well. And you can see how the lower teeth come forward, and that space is provided by the correction of the upper incisors, which were tilted back like so and trapping the lower incisors. So by normalizing that top arch, it creates space for the lower teeth to swing into. You can also see from the simulation that certain little bobbles are needed to be added to the teeth, and these are called attachments. They're a very specific scientific shape and size. They're not just random blobs. And these are designed using AI from the computer, although the orthodontist can actually alter and change these, like I've done in this instance, for specific circumstances. So it's the very best type of AI, which is that also has intelligent human interaction as well. At the end of the day, though, this is really just a very advanced cartoon, and you might say, well, that may not even be possible in my case. So what we have here are the final photographs. So this is the final smile, which reflects the simulated position, in fact even a little better. The side bite, if I get rid of the attachments, is pretty much perfectly produced, and that's the same on both sides here. Even when these teeth even started in a crossbite. So you can see how that arch is expanded. the lower arch as well, nicely aligned. Here it shows a bonded orthodontic retainer, which many people use to help maintain that, and that reflects what we've got. And the top arch as well, which is of course the teeth that people smile with. The Americans call these front six teeth the social six, which I think is quite apt really. And that you can really see develop beautifully. So you can also see the change in comparison and how the bone has remodeled, and we've reorganized the gum margins. Now, I actually used a dental laser in combination with orthodontics for this as well, but there was absolutely no restorative input at all. And by restorative, I mean by tooth-colored additions. This patient needed no crowns, no veneers, no root fillings, no implants. It's entirely natural. And that's one of the nicest things about orthodontics. It creates a beautiful smile, but it's in harmony with nature. And it's not artificial. You don't look like you're wearing dentures. And the nice change to the smile as well. You can see we've broadened this lovely lady's smile, and this looks great now every time she smiles and when she talks. So I hope you've enjoyed this introductory video to the power of clinchecks and the benefit of digital models and how we can use them in our practice in Lincoln to help predict where we're going and to help patients visualize where they're going to end up. So thank you very much for your attention, and if you're interested, please book through and we'll see if we can do the same for you. Bye!